Have you ever wondered how a small mistake, a minor decision, can change your entire world? Can drugs or alcohol really affect your brain to the extent that you lose the ability to distinguish between reality and delusion? Isn't it frightening to think that you might see or hear things that aren't actually there? If these questions are stirring in your mind, then you should stay with us in this video. In today's video, we're going to talk about something called substance-induced psychosis. This is a mental condition that isn't often discussed, but it's very important to understand. So, let's start with the basics and make it as simple as possible. Firstly, we will look into what is this? How many types are there? What are the symptoms? What causes it? What are the treatment options? And finally, the conclusion. First, we will understand what is substance-induced psychosis. Let's see. Substance-induced psychosis is a serious mental health condition where someone experiences loss of contact with reality due to using drugs or alcohol. This might mean seeing things that aren't there, believing things that aren't true, or feeling unusually suspicious. I hope you now have a bit of an idea about schizophrenia. Let's move on to the next point where we will learn about its types. Let's look at its types and understand them one by one. There are two main types of substance-induced psychosis. First, psychosis during intoxication. This happens when someone uses drugs or drinks alcohol and starts experiencing things like hallucinations. For example, using LSD or methamphetamine can make a person see or hear things that aren't there. Second, psychosis during withdrawal. This can occur when someone suddenly stops using a substance they are addicted to, like alcohol. For instance, a person might start seeing or hearing things when they try to quit drinking after a long period of heavy alcohol use. Friends, these were some of the common types of substance-induced psychosis. Now let's move to the next point where we will learn about its symptoms. Substance-induced psychosis has many symptoms, but in this video, we have covered some common ones. Common symptoms of substance-induced psychosis include, such as hallucinations. Hallucinations involve seeing, hearing, or feeling things that don't actually exist. It's similar to watching a movie that only you are aware of, where you can see or hear characters that others can't. Next, delusions. Delusions are strong, incorrect beliefs that someone holds, such as believing they possess special powers or are being attacked. These beliefs remain unaltered, even when clear evidence is shown that contradicts them. Next, extreme suspicion. Individuals may feel excessively suspicious or paranoid without any valid reason, fearing that they are being followed or watched, even when there is no evidence to support this. Next, agitation, manifesting as restlessness or aggressive behavior without a clear cause. This often involves a lot of unnecessary physical movement or verbal outbursts that seem out of place. Next, appetite changes, having significant changes in eating habits, which can involve eating much more or much less than usual. This often leads to noticeable weight gain or loss that is easily observable. So friends, those were some common symptoms of substance-induced psychosis. If you have information about any other symptoms, please write them in the comment box. Now let's move on to the next point. What are the causes of schizophrenia? Let's see. Substance-induced psychosis is caused by excessive use of drugs or alcohol that directly affect the brain's chemistry. Common substances include cannabis, cocaine, LSD, amphetamines, and even alcohol. The psychosis might appear during active use or after stopping the use suddenly. These were some common causes. Now let's move on to the important points where we will learn how it is treated. Substance-induced psychosis can be treated in several ways. Let's see. This is how substance-induced psychosis treated, such as immediate cessation of substance use. The first step is to stop using the drug that caused the psychosis. Next, medication. Doctors often prescribe antipsychotic medicines to help control the symptoms of psychosis. Next, therapy and support groups. Therapy can help address the underlying issues related to substance use, while support groups provide a community of people facing similar challenges. Next, rehabilitation programs. Long-term treatment programs may be necessary to prevent relapse and ensure recovery, especially if the substance abuse was severe. Friends, these were the methods to treat substance-induced psychosis. If you feel any point was missing in this video, please do let us know in the comments section. Finally, let's look at the conclusion. Understanding substance-induced psychosis is key to dealing with it effectively. If you or someone you know is experiencing these symptoms, it's important to seek professional help. Remember, treating this condition is not just about stopping drug use. It's about comprehensive care and support. Thanks for watching, and don't forget to like, comment, subscribe, and click that notification bell so you don't miss our future videos. Share this video to help spread awareness about mental health. Stay safe and take care of yourself. We will meet again in the next video. Until then, stay happy and take care of yourself. Thank you.